Did you know that the posture you choose for sleep tonight might be quietly speeding up the aging process, taking away valuable vitality from your heart, your mind, and even your independence? It sounds hard to believe, yet based on recent insights from aging research, specific sleep positions may significantly increase your risk of serious health events, cognitive changes, and lasting discomfort. Here is the specific detail that is rarely discussed, which is that the majority of seniors are making this error every single night without even realizing it. For millions of aging individuals, getting a good night of rest has become increasingly difficult, involving tossing, turning, and waking up feeling drained or sore. However, ask yourself if the problem is not the duration of your rest, but rather the actual physical manner in which you are resting. Researchers now suggest that your alignment during sleep can either facilitate healing in your body or gradually contribute to its wear and tear. It has the potential to soothe your joints, protect your spine, and improve circulation. Or it can accomplish the exact opposite effect. Tonight, we are looking closely at the reality regarding the 4 most problematic sleeping positions you should avoid after age 60, and the 4 superior alternatives that can replenish your energy, sharpen your focus, and even help you wake up feeling rejuvenated. Stay with me, because the information you are about to learn might change how you approach sleep for the rest of your life. Before we get started, if you have not subscribed yet, I recommend you click that button and turn on the notification bell so you never miss another wellness tip created just for you. If you enjoy this video, please type 1 in the comments, or if not, type 0 to let me know how I can improve the content I create for you. We will begin by discussing the first of the 4 sleeping positions that are generally considered unfavorable for older adults, which is sleeping on your stomach or the face-down position. It might seem relaxing at first, lying belly down with arms tucked under the pillow, drifting off as though the stresses of the world cannot reach you. Many older individuals, much like a retired builder we will call Harold, claim it is the only method they can use to fall asleep effectively. He once mentioned to his healthcare provider that it seemed like his back finally loosened up in that position. However, what he failed to understand was that this temporary relief was quietly straining his neck, his spine, and even his ability to breathe properly. Night after night, resting on your stomach may seem harmless, but for seniors, it places a silent stress on some of the most sensitive areas of your anatomy. When you turn your head to the side for hours, your neck muscles twist unnaturally, potentially limiting blood flow and compressing delicate nerves along the spinal column. Over time, this often results in persistent stiffness, headaches, dizziness, and that familiar numbness in your hands or arms when you wake up. According to chiropractic experts, this stance raises the risk of cervical issues, a condition that can create long-term stability and coordination challenges, which is particularly risky for older adults. The potential downside does not end there, because pressing your chest into the mattress restricts how fully your lungs can expand. Your diaphragm cannot move freely, forcing shallow breathing throughout the entire night. For someone past the age of 60, this means less oxygen reaching your heart and brain, which can contribute to fatigue, foggy thinking, and even elevated blood pressure. Even worse, sleeping face down places unnatural stress on your lower back, particularly if you already manage issues with spinal arthritis or disc problems. Sleep specialists often refer to this as the most aging posture for the spine because it accelerates wear and tear. They clarify that over time, it hastens the degradation of the vertebrae, similar to bending a tree branch repeatedly until it eventually weakens. So while stomach sleeping might feel cozy, it is quietly compromising your comfort in the long run, one restless night at a time. If lying on your stomach is problematic, you might wonder about curling up on your side, which feels instinctive and reassuring. Yet it hides its own set of drawbacks, which we will reveal next. If you are still watching and finding these insights helpful, please comment number 1 below to let me know you are following along. Now let us proceed to the second point, which concerns sleeping in a fetal curl with knees drawn up to the chest. It is a stance that feels very familiar, almost like returning to childhood. Many older adults tuck into a compact ball at night, knees pulled up high and arms held close, as if to shield themselves from the surrounding environment. For a grandmother we will call Eleanor, this was her lifelong habit, because she said it felt secure, like hugging herself to sleep. But after years of waking up with shortness of breath, back stiffness, and increasing tiredness, her doctor revealed that her cozy posture was restricting her body every night. Resting in a tight ball may soothe the mind, but it quietly constricts the body, particularly for seniors. According to sleep foundations, when your knees are drawn too close to your chest, your diaphragm becomes compressed, decreasing the space for lung expansion. This limits oxygen intake, compelling your body into shallow and rapid breathing patterns. For older adults whose lungs may already be less flexible, this subtle reduction in oxygen can result in chronic tiredness, morning headaches, and even stress on the cardiovascular system. However, the concerns do not end with breathing, because curling tightly for hours forces the spine into an unnatural curved shape, shortening the muscles and ligaments that maintain good posture. Over time, this causes spinal alignment to suffer, making you appear more hunched, less steady on your feet, and more susceptible to balance issues. Spine experts caution that for seniors, sleeping too curled up is like spending the night training your body to shrink. This story serves as a caution for many because what started as comfort gradually became a routine that compromised energy and posture. The fetal curl may feel like protection, but for aging frames, it can be a trap that steals strength, breath, and stability night after night. So if curling up feels incorrect, what about lying flat, like the soldier position many doctors once recommended for spinal health? It might surprise you, but that position also bears hidden risks that few seniors understand until symptoms appear. For decades, physicians used to claim that lying flat on your back was the healthiest way to sleep due to a straight spine and even weight distribution. But for older adults, the reality is far more complex and potentially more problematic. What once appeared like a stance of discipline and order can quietly become a nightly struggle for your heart, your lungs, and even your brain function. Consider a retired serviceman we will call Robert, who slept like a soldier his entire life, flat on his back, with his head barely on a cushion. As the years went by, his partner started to observe odd occurrences such as long pauses in his breathing at night, loud gasps for air, and mornings where he awoke drained. When he finally visited a sleep expert, the diagnosis was severe obstructive sleep apnea, meaning his sleeping posture was blocking his airway multiple times per hour. When seniors lie flat on their backs without appropriate head and neck support, gravity allows the soft tissues to collapse backward, narrowing the air passage. This leads to snoring, difficulty breathing, and interrupted sleep, sometimes without the sleeper even realizing it is happening. According to medical research, untreated sleep apnea in older adults can significantly raise the risk of cardiovascular events and cognitive issues. It also elevates nighttime blood pressure, quietly taxing the heart as it works harder to circulate oxygen. That is not the only risk, as lying flat also aggravates acid reflux, a condition that impacts a large number of older adults. When your head is level with your stomach, gravity no longer keeps digestive acids where they belong. The acid creeps upward into the throat, irritating the esophagus and disturbing sleep quality. Over time, It can even affect the vocal cords and lungs, which doctors sometimes refer to as silent reflux. For the man in our story, the change came late, as years of poor sleep had already taken a toll in the form of constant fatigue and high blood pressure. His experience reminds us that sometimes stillness conceals potential health risks. If sleeping flat can quietly impact your heart and brain, consider the implications of sleeping half-sitting in a recliner chair. You might be shocked to learn how this seemingly cozy arrangement could slowly weaken your body from the inside out. If you are still watching and finding these insights valuable, please comment number 1 below to let me know you are here. Now let us continue with point number 4, which is sleeping in a recliner chair every night. It begins innocently enough, as for many seniors, the recliner feels like a wonderful relief, a soft spot to rest sore joints or take a brief nap. When lying flat in bed becomes painful due to backaches or other conditions, that same recliner slowly transforms into a permanent sleeping arrangement. But as soothing as it feels, sleeping in a recliner every night is a habit that older adults should approach with caution. Take the case of a widow we will call Dorothy, who discovered she could finally sleep through the night in her recliner after dealing with hip pain. Over time, she observed her legs swelling, her back stiffening, and her overall energy fading. What she did not realize was that her cherished chair was slowly affecting her health negatively. According to rehabilitation experts, sleeping in a recliner keeps your body in a semi-seated posture that can restrict optimal blood circulation to the legs. The result is often fluid retention, swollen ankles, and in some cases, circulation issues that can become serious. The partially upright angle also prevents your spine from fully relaxing, causing chronic lower back tension and hastened muscle weakening in the hips and abdomen. Over months or years, this leads to stability issues and a higher risk of losing your balance. Furthermore, because the reclined stance limits deep sleep cycles, your body never truly replenishes itself fully. You might close your eyes for 8 hours, but your brain and muscles stay in a constant state of light rest, never reaching the deep recovery stages your body desperately needs. Dorothy eventually returned to a regular bed after a doctor cautioned her that prolonged recliner sleeping could compromise her long-term mobility. She stated that she thought she was resting, but she was slowly shutting down her physical capacity. So, if the recliner is not the ideal place, where is the optimal place to rest? The answer resides not just in your bed, but in how you position your body to maximize health. In the second part of this discussion, we will explore the 4 sleep positions that can truly help you recover and protect your well-being. Let us discuss the first better sleeping position for seniors, which is the supported side sleep with a pillow between the knees. It is one of the most basic changes you can make, yet for seniors, it can alter the way you rest and wake up each morning. Sleeping on your side with a soft pillow gently resting between your knees may appear ordinary, but for your spine and joints, it is one of the most beneficial positions you can select. Consider a retired firefighter named Alan, who awoke every morning for years with a dull ache in his lower back and hips. Pain management helped slightly, but the stiffness always seemed to return. During a routine checkup, his physical therapist asked him simply how he slept, and he replied that he slept on his side with his knees together. That night, under professional advice, he tried placing a small cushion between his knees and adjusting his head so that it aligned with his spine. Within 2 weeks, his discomfort had diminished significantly, and he felt as though his body could finally relax. There is genuine science behind this, as research suggests side sleeping, particularly on the left side, promotes better circulation and lowers acid reflux. The pillow between the knees keeps the pelvis level, alleviating pressure on the lower spine and hips, which are frequent pain points for older adults. It also minimizes the twisting motion that creates morning stiffness and joint inflammation. Doctors often praise this posture because it naturally supports the curves of the body without adding stress. It is also considered one of the safer positions for those with breathing issues, as it helps keep airways open through the night. This story is not rare, as thousands of seniors have discovered that this tiny adjustment can mean the difference between waking up weary or waking up strong. If you are one of the many who cannot sleep on their side for long, do not worry, because there is another option. There is another position that uses a gentle incline to protect your back, ease digestion, and even help you breathe easier. Let us discuss that next, which is the elevated back sleeper position where the head and knees are slightly raised. For many seniors, sleeping flat on their back feels too rigid and uncomfortable. Yet, with a small modification involving a gentle elevation of the head and knees, that same position can become highly therapeutic. This is what doctors term the elevated back sleeper position. And for older adults, it can make the difference between agitated nights and truly restorative sleep. Take the example of a retired teacher named Linda, who had struggled for years with digestive acidity and shortness of breath. At night, she often woke up coughing, her throat irritated from the acid reflux. Her specialist proposed elevating her upper body by about 30 degrees and placing a small pillow under her knees to relax the lower back. The results were significant, as within days she noticed she could breathe easier and sleep through the night without interruption. Science clarifies why this functions so well, as elevating the head and chest assists gravity in keeping stomach acid down and airways open. According to sleep medicine organizations, seniors who sleep with their upper body slightly raised experience fewer breathing obstructions. This reduces nighttime oxygen drops that can tax the heart and impact brain health over time. Meanwhile, elevating the knees gently eases pressure on the lower spine, allowing muscles to fully loosen. Specialists often tell their older patients that it is not about sleeping longer, but rather about sleeping smarter. By giving your body the right angles, you are giving your heart and lungs room to function freely while you rest. But what if you are searching for a position that not only supports your breathing, but also rejuvenates your joints and shoulders? The next one, often overlooked yet powerfully restorative, might be the missing piece in your sleep routine, known as the starfish position. This involves back sleeping with arms out, and there is something peaceful about lying this way, as if your body is finally letting go of the day. While it might look simple, it is one of the most restorative ways for seniors to rest when done correctly. Unlike lying flat and rigid like a soldier, the starfish position gives your body freedom and space. It lets your shoulders open, your chest expand, and your joints release the tension they have held all day long. Consider a retired nurse who found that after decades on her feet, her shoulders ached continually, and her neck was stiff. Her chiropractor suggested she try sleeping like a starfish, arms relaxed and palms up, with her head supported by a contoured pillow. She was skeptical at first, but within a week, she noticed a distinct difference in her comfort levels. Her neck pain eased, her shoulders felt looser, and she felt significantly more refreshed in the mornings. Science explains that when the arms are open and the shoulders are not compressed, blood flow improves to the upper spine and nerves. According to medical research, this posture can reduce tension headaches and help prevent nerve compression, a cause of numbness in older adults. The position also supports calm breathing because your chest is not constricted, allowing oxygen to move freely, which helps soothe the body. Experts sometimes call it a natural reset for the upper body. Still, not every back sleeper feels comfortable for long, as some find their lower back starts to ache, or they crave gentle support. For those seniors, there is one more position that offers a balance between comfort and safety. It is called the 45-degree side recline, and it might just be the healthiest way to sleep after age 60. Imagine lying halfway between sitting and sleeping, with your upper body gently supported and your spine relaxed. That is the 45-degree side recline, a posture many specialists consider a sweet spot for senior sleep. It combines the comfort of side sleeping with the health benefits of elevation. For people over 60, this position can be truly beneficial for managing various age-related conditions. Take the example of a former truck driver named Walter, who had tried everything for his back pain and breathing issues. New mattresses and medications did not work, so his therapist suggested this gentle adjustment. He positioned himself at a 45-degree angle on his left side, using a firm wedge for support and pillows for his knees and head. The first night, he noticed a difference with no breathing struggles and significantly less discomfort. Within a week, his sleep quality improved, and for the first time in years, he woke up feeling clear-headed. Science confirms that this posture reduces digestive reflux episodes significantly. It keeps airways open to prevent obstructions and supports spinal alignment, which is critical for those with bone density issues. It also improves circulation, allowing the body to function efficiently during sleep, a process linked to brain health. Therapists often remind patients that sleep is recovery, and the body heals best when supported rather than strained. The 45-degree side recline may look simple, but for seniors, it acts as a nightly preservation of health. Before we close, there is something even more important to understand, which is how all these positions together can transform your life. Let us bring it all together in the final conclusion, where small changes tonight could mean a stronger tomorrow. Sleep is not just rest. It is a process of renewal. As we grow older, every night of sleep becomes more than just a pause. It becomes a form of healing. The way you sleep determines how you wake up to life itself. For seniors, the right sleeping position is not simply about comfort. It is about protecting vital functions and preserving independence. The truth is simple yet powerful, which is that your body responds to how you treat it while you sleep. When you lie the wrong way, it quietly collects tension and fatigue. But when you sleep in alignment that is supported and balanced, your body begins to repair itself naturally. Muscles relax, joints release, and your body functions more easily. Doctors agree that even small changes can mean fewer aches and deeper rest. So tonight, do not just go to bed, but create a sanctuary for your rest. Let your body find its healing rhythm, because when you give your body the right rest, it gives you back strength and clarity. Sleep well, live well, and remember that your best years can still begin with tomorrow's sunrise. These lessons are meant to inspire you to live fully and authentically. Now, I would love to hear from you, so take a moment to reflect and share one thing you have learned. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1, or if not, feel free to comment with 0. Your feedback means a lot to us. Do not forget to like, share, and subscribe to our channel for more content like this. Thank you for watching, and here is to living life on your own terms.